Today we're going to review health benefits for the upcoming year 2026. There's some high-level takeaways that I'll try to impart on you as we go through this, recognizing that healthcare is a nightmare all on its own. And so each year, Hope does everything we can to try to keep both the cost of the healthcare plans down, as well as the cost of using the healthcare plans down. So we'll talk about this pretty directly and go through everything that you need to know. As I talk about healthcare today, one of the things to note is that these benefit changes will take effect January 1. If you are a new employee or newly eligible for benefits and you are still within a waiting period, then that waiting period will still be in effect. So your benefits might not start until February 1 or March 1, depending on your waiting period. So just noting that. You will see that on our health benefits, we're going to talk about health, dental, vision, our flexible spending options, short-term disability, long-term disability, and life insurance. That's what we're going to cover today. That's not all of our benefits, but those are the things that we want to impart some knowledge on today. You'll see at a glance our providers for benefits right now, health, dental, vision, life, and disability are all through that Blue Cross Blue Shield umbrella. Our flexible spending options, currently we use WEX Chard Snyder, and we will be changing providers to EBC, Employee Benefits Corporation. So you can see some of those providers. Your health, dental, vision, and flexible spending options are all optional coverages. Life insurance, short-term and long-term disability are mandatory automatic enrollments, and so we'll talk about some of the impacts to those as well. Open enrollment is a time for everyone to make changes, add dependents, cancel coverage. This is really the window to do that. All three of our health plans this year are PPO plans. So what this means is that you have a preferred provider option. As long as you stay inside of Blue Cross Blue Shield's network of providers, you're going to get the best benefits for your plan. The benefit of having a PPO plan means that you do not need a referral to go see a specialist. You can drive your own healthcare and go see those specialists independently. One of the big changes this year, in addition to moving away from Health Alliance, is that instead of offering 2 health plans, we're going to be offering 3 health plans. And this is designed to give employees as much opportunity for cost savings as possible. And so we'll work through those plans. Our Blueprint plan is the closest to our current PPO that we have, and the high deductible health plan pretty much matches the one that we had through Health Alliance. The middle plan, the Blue Choice plan, is new this year, and it is a plan that offers a tiered network of in-network providers. And so we'll talk a little bit about that, what it looks like, and who that would be beneficial for. Our first plan, the Blueprint PPO plan, you can see the costs in the upper right-hand corner here. This is our most expensive plan as far as the premium. So this one costs you the most to purchase per pay. It has a higher out-of-pocket maximum. And so when we look at the out-of-pocket maximum for this plan, the highest you'll pay individual-wise is $6,500, but for a family, it's going to be $18,400. And so if you're looking for family coverage, that is the highest out-of-pocket maximum of the 3 plans. This plan offers lower office visit copays. So to see your primary care, it's $35 and a specialist is $60. For each visit, that's going to be a copay. Those payments do not tie into the deductible. So the deductible for this plan is $3,000 for the individual, and the out-of-pocket max is $6,500. So that's up $500 from last year. You're looking at lower emergency room copays. So to go to the ER, it's only $150. The great benefit about this plan, the Blueprint PPO, is that you are dealing with one network of defined providers. So if the doctor is quote unquote in network, then they're in network. There aren't these tiers that you have to navigate within the systems. To talk here locally, Springfield wise, all of our major providers, Memorial, HSHS, SIU School of Medicine, and Springfield Clinic are all considered in network with Blue Cross Blue Shield. So all of those providers fall under that in network list. The second plan is this Blue Choice option, and this is a 3-tiered network product. So the way that this works, tier 1 is a smaller network with more cost savings. Tier 2 is still in network. It's a little bit broader, but it costs more. And then tier 3 is out of network. And so the takeaway for local employees here is that the individual deductible for this plan is $3,000 in tier 1. So if you are going to Memorial, HSHS, SIU School of Medicine, all of those are considered tier 1 providers. If you are going to Springfield Clinic, that is currently considered a tier 2 provider. And so tier 1 individual deductible is $3,000. Tier 2 individual deductible is $4,500. And so the way that this works, if you have met your individual deductible of $3,000 and you suddenly go to a provider that's in tier 2, you have an additional $1,500 to meet before you've met that total $45,000. But the $3,000 ties into the $4,500. The out-of-pocket for the individual, out-of-pocket max is $5,500 if you stay in tier 1, which is the lowest. That's the lowest out-of-pocket maximum that we can offer if you're staying in tier 1. In tier 2 is $6,500. So similar to the Blueprint plan on the out-of-pocket maximums. The difference here in the plan itself, this one's going to have lower premium costs. So it costs less to have this coverage. There is a lower out-of-pocket maximum, which we talked about was $6,500 in tier 2. The family out-of-pocket is $18,000 instead of $18,400 on the Blueprint plan. You have a higher office visit copay. So you're looking at $40 for a primary care visit and $65 for a specialist, but that is in tier 1. So if your primary care is in tier 2, such as Springfield Clinic locally, you're going to pay $65 for each visit. If your specialist, which most of the specialists here locally are in Springfield Clinic, if your specialist is at Springfield Clinic under this plan, it's a $130 copay for each visit. The same rules apply for the diagnostics. So if your primary care orders an x-ray, if they're in tier 1, then you're looking at $65. If they're in tier 2, you're looking at $130 for each instance of seeing these providers in tier 2. The overall takeaway of this is that Blue Cross has to pay Springfield Clinic more money. Like their contracts are not as good, they don't have as good of discounts. And so because it costs Blue Cross more, they're pushing that cost through to the plan participants. I mean, that's kind of the takeaway. So under this plan, there's cost savings available if you are not going to any tier 2 providers. The tiered system is an Illinois initiative only. So this plan is great for any employee that we have outside of Illinois. If you are located in any of our ancillary states, any Blue Cross Blue Shield provider who is in Blue Cross's network will be considered tier 1 for out-of-state people. So it's a great option for anyone outside of Illinois, but inside of Illinois, you really have to navigate these different tiers and the cost structures, which is probably the most challenging factor of this. Let's see. The third plan is the qualified high deductible health plan. There's no significant changes in this plan. This pretty much mirrors the plan that we had through Health Alliance. The individual deductible is $5,000. The out-of-pocket maximum is $7,000 for an individual and $14,000 for a family. Again, the lowest family out-of-pocket maximum is this plan right here. The high deductible health plan is still a PPO plan where you don't need referrals to see providers. The biggest difference is that instead of having co-pays for your office visits, you just pay for the office visit outright. And you take up 100% of the cost of your healthcare until you meet that $5,000 deductible. So this plan can be beneficial. The co-pays on the other plans, the Blueprint and the Blue Choice, those co-pays do not tie into the deductible. So if you're going to Springfield Clinic on the tiered system, every time you pay $130, that doesn't go towards your deductible. So something to consider as well. The benefit of this high deductible health plan, one, it's the most affordable as far as the cost of the coverage. But two is, again, you only have one network to deal with. You're looking at, is this doctor in network? And the answer is yes or no. You don't have to navigate multiple tiers of in-network providers. The thing that I will share about health insurance in general, and I'll go to the next slide as I do this. This is a comparison slide of all three plans. When you look at these three plans, they all have high deductibles, whether it's $3,000 or $5,000. The first several $1,000s of bills each plan year are out of pocket. And so you really have to think about yourself, your coverage, and how much you anticipate using this healthcare in the next year. If you don't think you're going to accumulate $3,000 in medical bills, the high deductible plan might be the best option because you're going to save money just on the front end. It's a cheaper plan, and no matter what, you're capturing 100% of the bills to start with. So before I move on, any questions about the health insurance plans? And Deb might have to jump in if we have any. I don't know that I can see the chat box.
We only had one so far in the chat, and that was about the tiers applying only to Illinois. And she did feel that you had answered that question. But
okay.
I'm not seeing anything else in the chat, and I am not seeing any kind of reactions or anything along those lines.
If you guys have questions and you're not sure how to type it out, just make a note in the chat box, and Deb can unmute you the next time that I pause for questions. So we want to make sure that we're getting everybody's questions, just because it is confusing. Talking about our Hope Wellness program, for the last 5 years, we have really gotten into a routine of encouraging our employees to get their annual wellness exam. Under affordable care, wellness is covered at 100%, everything preventative. So there's no co-pays, no costs, no matter what plans you're on. We encourage our employees to get their annual physical and biometrics in the attempts to try to prevent any catastrophic healthcare concerns, right? Going to that physical is the best thing you can do for that. The way that the wellness program works,
hey,
employees,
Kristi,
yes.
I hate to stop you, but we literally just had 2 questions pop
Right.
in. So before you get too far along the lines, can you explain more how cost of labs work in the Blueprint option?
Yes. So in the Blueprint option right here, your labs are going to depend on who orders them. I had asked our broker these questions as well. So if lab work is ordered by your primary care doctor, then you'll pay that $35 copay. If lab work is ordered by a specialist, then it'll be the $60 copay. So it really just depends on who's driving that healthcare. That's a good question.
Did that answer your question? Is that same for x-rays? And even at Leadwell?
Lead well. So for our employees who are local to Springfield, we have a clinic inside one of our buildings that they can go to for acute care issues and lab work. So that's still available. Employees can still take advantage of that within the current structure. The way that Leadwell works, it doesn't charge health insurance. Hope just pays for it directly. So lab work can still be done at Leadwell. There's no X-rays or any kind of advanced care there, but that's still an option.
What about x-rays? Is that still handled by who's ordering them? Say Wave
Yes,
Labs.
yes, exactly.
Okay. And are in-network office visits usually discounted?
Yes, it depends on. So if you're on the Blueprint plan, an in-network office visit is going to be 35 or 60, depending on the doctor and their specialty. For the Blue Choice plan, these are the discounts. This is your in-network discount. It just depends on if they're tier one or tier two. I mean, the tier two discount for a specialist is $130 copay per visit, which doesn't feel discounted. Just for anyone locally who wants access to Springfield Clinic, I don't know that that middle plan is a good choice.
Can you explain medication coverage?
I can. Look at this. This is fun for me. Uh, the Blue Cross Blue Shield has three or four preferred pharmacy options. The most well-known one is Walgreens. So if you're using a local Walgreens, you're going to get the very best discounts. Depending on where you get your pharmacy refills, like where you get your drugs, that's going to depend on the cost. So if it's a preferred provider and it's a generic drug, then it could be $5. If it's a preferred provider but not a generic drug, then it could be up to 15. So it really just depends on the drug and where you're getting it filled, what the range is going to be for the cost.
Okay. So, Katie, doctor, I'm going to go ahead and unmute you so you can have some follow-ups because she said, so labs at Leadwell used to be fully covered, $0. Now they are 60 or 130.
No, not Leadwell, not Leadwell, but Leadwell is only Springfield. So this webinar takes a much larger approach, but nothing is changing with regard to Leadwell.
Perfect. That's it. Thank you.
Okay.
Of course.
All
Of
right,
course.
so we got to it. Give me just where are you, Katie? I want to get you muted again. Really? All right. We also have another question though. Blueprint option is WashU, Barnes Jewish, and St. Louis considered in-network even if we live in Illinois? See specialist at WashU for periodic follow-ups.
I'd have to look at Barnes and WashU. But I feel pretty confident, at least on the Blueprint plan. Those are both large providers. They're both in Blue Cross's network. But I don't know where they fall because the tiered initiative is for Illinois residents. So it doesn't apply when you live out of state, but I don't know how it would work if you're traveling from Illinois to Barnes Jewish. So I can find out and follow up on that. Okay.
That was C. Humphrey asking that.
Oh, love that. Thank you. I'll follow up with you, sir. Okay.
We also had another, Lynn was also curious about WashU. So,
Okay. Okay, great.
all right. So, for urgent care and Blueprint, we pay full cost of appointment until we meet our deductible? Question.
It looks so a couple things. Urgent care has to all of these like pop-up shops, if you will, of like Memorial Express Care and those are not necessarily considered a true urgent care. So you would have to check Blue Cross's network to make sure how they're going to code it. But under the Blueprint plan, urgent care after the deductible, so after you meet the initial $3,000, then you're just paying 20% of the cost. So pretty much your bills are on you for the first 3,000, no matter which plan you've got, at least.
Okay. Anybody have any other questions? This was a great conversation. I don't want to cut anybody off, but I also know we want to keep this rocking and rolling because we.
Well, and I'll do this a couple other times too,
Yeah.
as we
Okay.
get through different chapters.
Okay. All right.
Okay. So thanks, Deb. The takeaway for wellness is that your wellness exam from 2025 is going to give you discounts next year on your 2026 benefits. If you had your wellness between November 1 of 24 and October 31st of 25, then you qualify. If you have not submitted those documents yet to Human Resources, please make sure you do so, sending them to Orietta Moore so that we can make sure that we get you your wellness discounts. If you are going to be new to Hope's health insurance for the first time, or you're newly eligible for health insurance, you'll have a 60-day window to provide us with your wellness, whether that's a new one that you get during those 60 days or something that you've had in the last 12 months. But we want to make sure that we get you those premiums if you qualify under these terms. So as 2026 goes on, whenever you're due for your annual wellness, make sure you go and do that because that will qualify you for premium discounts in 2027. Just really encouraging that wellness piece. Dental coverage this year, the only thing that's changing is the cost, and that's a reduction of 13% in cost. So our dental coverage is really, really nice. There's a $50 deductible initially. All of your preventative stuff is covered at 100% if your dentist is in network, 90% if your dentist is out of network. When you get into mid-level things such as fillings, those are covered at 80% regardless of where your dentist falls, and any major restorative stuff, inlays, onlays, crowns, root canals, all of that is covered at 50%, whether your dentist is in or out of network, which is really nice. There's a maximum benefit each year of $1,000, but this is really affordable coverage, and I think a lot of our employees take advantage of this. So please consider this if you don't currently have dental. Our vision insurance isn't changing at all. So no change in the cost or the coverage. This gets employees an eye exam once every 12 months. It gets you $100 towards lenses in your glasses or contact lenses every year, and $100 towards frames once every 2 years. So if you go to the doctor at all, this coverage pays for itself and then some, and no changes there. I want to talk briefly, and I'm going to try to get through pre-tax and flexible spending, and then we'll open it up for questions again. But I want to talk about how to save money on health expenses using pre-tax dollars. There's a couple of different ways to do this. So if you're in the Blueprint or the Blue Choice plan options, you should consider flexible spending accounts. If you're in a high deductible health plan, you can sign up for a health savings account. The way that these benefits work, you can take money out of your check before it's taxed to use for eligible expenses. And so I'm going to dig into this a little bit more. Our health benefits are part of a Section 125 cafeteria plan. And what this means is that you can kind of pick and choose, like you're at a cafeteria, of what works for you and what works best for you. And so if you've gone into the ADP portal and poked around a little bit, it looks like we have 12 different health insurance options. This is not the case, but you have to identify, are you choosing a plan that's with wellness or without, knowing whether or not you've done your wellness, and then you have to choose whether you want those premiums pre-tax or after tax. And this is what I want to talk about. It's always a source of confusion for employees. So a pre-tax benefit means that we gather up all the money in your paycheck And if you have your health insurance premiums taken out pre-tax, we will pull out that $144 and then we apply taxes to your check. And so the more money that you pull out of your check before it's taxed, the less money you pay in taxes. And it's real, actual, money savings, higher take-home pay on your check by doing this. And so we'll talk a little bit about what's best for each person with with the pre-tax options. They are the best option unless you want the ability to cancel your coverage mid-year without a qualifying event. So if you have a qualifying event for healthcare, you can do all kinds of things. But if you want to just come into Orietta in 3 months and say, you know what, this coverage is too expensive, I want to drop it, then you have to choose an after-tax benefit. And the after-tax benefit means that we gather up all the money for your paycheck, we tax it, then we pull out that $144. The only thing that employees should really consider, if you're within 3 to 5 years of retirement, your pre-tax premiums can have a tiny effect on your Social Security benefits. So if you're close to retirement, you might want to consider an after-tax benefit, but even then, pre-tax is going to save you the most amount of money. So you have to make that choice for each coverage that you have. Maybe you want pre-tax for health insurance because you're never going to cancel, but this is your first time with the dental coverage and you're going to choose after tax and you may cancel it in 6 months. So each one, like that cafeteria moment, you can make those choices on. When we look at flexible spending options, your flexible spending account you can have one for healthcare costs as well as dependent care costs. And so you can identify money pre-tax to pull out of your account that says this is money I'm going to spend on healthcare. And it's tax-free. And so you can access it all year round. The benefit of a flexible spending account for healthcare costs is that you can access the total amount of money on day one. So if you put $1,000, you say, I'm going to elect $1,000 over 26 pay periods to go into this flexible spending account. One, like $670 will roll over next year. So you really only have to use a couple hundred. But two, you can access all $1,000 of that in January. So if you have a surgery or a great big medical bill, you can pay for it with your flexible spending account, even though you haven't put money in it yet. So it takes some pressure off of you in the beginning months of the year while you slowly put that money in pre-tax over 26 pays. This is probably one of the best underutilized benefits here at Hope. I think when we present healthcare and employees hear the word deduction, they're like, I don't want it. That's not something I want. But keep in mind, as much money as you can carve out of your check before taxes, you're really saving yourself money because you don't have to pay taxes on those dollars, which is just a huge benefit. There's also flexible spending options for dependent care. And so these are dollars that you can use for childcare, for before school, after care, even like dependent care for elderly individuals who might be in your custody. But this is a huge benefit as well. The difference in the dependent care program is that employees can only access what they put in. So if I say I'm going to put in 1,000 and 2-3 months in, I've got 300, that's what I can access is only what I've put into it. The thing about the flexible spending accounts is that they are completely independent of Hope's health insurance. You can decline all of our health insurance and sign up for a flexible spending account. As long as the items that you are using the money for are considered eligible expenses, then you're within your guidelines. It doesn't have to be flexible spending for healthcare costs for me. I sign up for flexible spending for healthcare costs and I use it for all of my family. Any medical bills we get, that's what I'm going to use that towards, whether I have Hope's health insurance or not. So really keeping in mind that these are also options for you that are not tied to any kind of coverage. So good benefits there. With flexible spending, you have to do a fresh enrollment each year. Nothing here at Hope rolls over. So if you want to do this again this year or starting this year, you have to go in and enroll in that option. You can enroll for both healthcare costs and dependent care costs if that's something you have. Let's see, employees who are currently contributing to a health savings account. And so in order to contribute to a health savings account, you have to be in a high deductible health plan. Those employees could only access a limited FSA. And the limited means that you can only spend it for dental and vision costs because your health savings account is going to be what covers your healthcare costs. So a little tricky there, but we can help you walk through that if you're one of these people. But as much as you can set aside pre-tax, you're going to save money on your check. You're going to take home dollars, which is just a huge benefit for you. This year, we are changing flexible spending providers. Hope has been using Wex, Chard Snyder, BPC. They've been purchased and sold and acquired and merged over the last 5 years. And we have seen our customer service from them just plummet. So we're making a move this year. There's a couple of things that you need to know pertaining to this. If you have flexible spending account right now, BPC is still going to handle the rollovers and the run out periods. And so currently, up to $660 of unused money in your account will roll over. Anything over that, you just lose. So we've got 30 days to spend that money down. That $660 will roll over with BPC for January 1 to March 31st. So you can continue to submit claims through BPC during that window. Effective April 1, anything that's left, we're going to migrate into EBC. So participants will lose no dollars or access to money at any point in time. There might be a short blackout period for a couple of days while we move your money from one system into the next. Employees who sign up for flexible spending this year, the 2026 will start with EBC. So you might have two accounts at once. And then leftover money from BPC will roll into that with EBC. So we'll be sending out information for people who are enrolled in these accounts so that they know what to expect and when to expect it. But we're hopeful that this is pretty seamless and that we can get a better quality of customer service from the employee benefits consultant group. Questions about wellness, pre-tax, after-tax, flexible spending options?
I very hesitantly say this. Currently, there is nothing in the chat, but we'll give it like a hot second to see if anybody is merrily typing. Again, if you want to raise your hand, if you're on a small screen and typing just isn't going to work for you, you can raise your hand. And if you don't know how to find that, if you go to the React button at the bottom of your Zoom screen and open that, at the very bottom, you should see a bar that says raise your hand.
Okay, I will continue. We can always address that at the end. We're close to the end. Next, we'll talk about short and long-term disability. So there are some changes here, but not in the providers or the coverage in general. Short and long-term disability is an automatic enrollment after 3 months. So all full-time employees are covered by this benefit. The cost for this is really varying depending on the employee, their salary, and their age band. So we do have some changes this year for 2026 in the overall disability cost structure. The benefit of this plan, there's a couple. One, because we enroll everybody, the costs for this are much lower than if it was an optional plan. But since it is 100% employee paid benefit, the claims that you file, if you need short-term disability or long-term disability, those claims are tax-free, which it's 60% of your regular earnings without tax, is very, very close to your take-home pay. This has been an amazing benefit for employees who really have medical issues that take them off work unexpectedly, right? We never really know how to plan for those things. If that goes longer than 13 weeks, then long-term disability kicks in as well. So it's a really wonderful benefit. Starting January 1, you will see a new per pay cost depending on what your annual salary is right now. So that will change as you grow within the organization. No changes to our life insurance program at all. This is also an automatic enrollment after 3 months. The biggest take home that I can focus on for you guys is updating your beneficiaries. So in the system, we've made it so that this doesn't stop you from completing your enrollment, but if you do not have a life insurance beneficiary identified, it can be very, very difficult for your family to access that money when they need to. And I've been here long enough to see this. This is a benefit that we don't want anyone to ever have to use. But in the cases where the employees had not designated their beneficiaries, it was a true nightmare for their families. So please make sure as you're going through the process, as you're in ADP, doing your open enrollment, that you are updating those beneficiaries as you go along. As far as next steps for employees, so we checked this morning and less than 30% of our full-time staff have done their open enrollment. So maybe everybody is just kind of, there's nothing like the last minute that gets people motivated. But next steps are to log into ADP and walk through that process. You're going to waive anything you don't want, enrolling in the things that you do want. After you have submitted your enrollment, you will receive an email from ADP that outlines what you have. You want to make sure that that's accurate. You can still make changes. Even after you submit it, you can make changes all the way through Friday. So as long as the open enrollment window is open, you can still make those changes. If you have not submitted that wellness preventative affidavit to Human Resources, please make sure that you do so. As long as it's within that November 2024 to October 2025 window, that will qualify you for discounted premiums this next year. And then if you are enrolling in a new flexible spending plan or have a current flexible spending plan, look for information to come from us as we're migrating into the new system. I think this captures the majority of our takeaways here. Again, this is a snapshot that is only specific to this year and to open enrollment. So we tried to capture what employees really needed to know in this moment. What kinds of questions do you have, if any?
We do have one. Give me just a second here. So if you don't use the 660 rollover for expenses before March 31st for 2025 expenses, will this money carry over to use for 2026 expenses for the remainder of the year?
Yes, it'll migrate into the new EBC. I also verified with them that if you don't enroll in a new plan, so like say you have a flexible spending with BPC, and you've got so much leftover money that you don't want to contribute this year, so you're not enrolling with EBC this year, they will still create an account for you and you will have an active account in April when that money migrates over from BPC. So no employees will lose any money outside of the overage of the 660. So if you have more than $660 in that account, you have 30 days to spend it.
Woohoo, time for new glasses.
Right. Go out to that. Go,
Go crazy.
You can
Get those Gucci
use
frames you've been looking at.
You can use that money for anything that falls under the FSA eligibility. And this can be things like expensive toothbrushes and Band-Aids and sunscreen and over-the-counter drugs. There's any kind of durable medical equipment. There's all kinds of things that you can purchase with those dollars rather than just letting them go to waste.
To reiterate, the high deductible plan is basically the same as the prior one.
Yes.
Okay. New employee here. What do I need to send in for the wellness benefit?
There is a wellness form that you can get from Orietta. It's an affidavit that your doctor signs that says that you've completed your physical as well as your biometrics. And the biometrics is just the lab work that comes with the physical. The takeaway here is that we don't ever want the results of your physical. Like, we don't want to know how well you are. It's just an affidavit that the doctor signs that says you've completed it. So it's important that our employees know we're just capturing a checked mark that you've done it, but your personal health information is still yours and should be kept confidential.
For a new hire, is there a specific place to go to get a wellness exam?
No, if you're waiting until you have our coverage, then you're just going to want to find a provider in network. If you're local here in Springfield, you can use a Leadwell. There's also one in O'Fallon in like the kind of southern area as well. But outside of that, you go to whoever you would like to see for your annual wellness.
Okay, and for clarification, open enrollment runs through Friday, and that would be 11:59 p.m. Friday?
I think we set it to close a business
Close of
Friday.
business. Okay. Where is the wellness form located, or do they just need to email Orietta and she'll send something?
I would have them email, or I think you can get it on the intranet. Like, it's out there under employee resources. But if you're not sure, just email Orietta and she can send you one.
I'm trying to bring up SharePoint real quick, and of course it's not loading. So
I feel this.
it's
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 Monday.
the internet. Why would it work?
Yes.
Does anybody else have any questions? That was the last one I saw in the chat. I don't see anybody with their hand up. So,
And you can also email us directly, myself or Orietta, with any specific questions. Some of them we might have to reach out to Troxel or the providers, but we want to make sure that you've got the access that you need to information before you make your choices. Okay, well, absent any other questions, that's all that we have today. So thank you guys for attending. Hopefully this was helpful. And we look forward to supporting you in 2026 with some awesome healthcare coverage through Blue Cross.
and also we had a shout out to Orietta. She was very helpful.
Great. Thank you guys. She's
Oh, hold
working.
it. One more question.
Okay.
I think they just threw that up there to give themselves time to type. So, does any of this cover pre-existing conditions?
It's a complicated question. I feel like under ACA, yes, healthcare should cover pre-existing conditions regardless. But if you have some specific questions or concerns, send them to Orietta and we can follow up with our broker to make sure that there's not a hiccup. Sometimes when you're changing from like when we went from Blue Cross to Health Alliance, there was this process that employees had to go through to make sure that they had this continuation of coverage if they were having like specialty services done. And so there might be something similar, like if you have a family member who's undergoing cancer treatments and you want to make sure that there's not any lapse in coverage, we can start that process with the providers and make sure that everything is smooth.
This would be as far as an amputee.
I don't know. We'd have to look at specifics, but I've not heard of any pre-existing conditions since before Affordable Care. It should not be an issue.
Okay. What's the difference between FSA Health and FSA Limited? I'm sorry if this was already addressed and I missed the details.
No, this is a great question. So FSA Health is for employees who are not currently contributing to a health savings account. So if you don't have a health savings account, you don't need to worry about limited. You're just signing up for FSA Health. If you are contributing money to a health savings account, which means that you are actively covered under a high deductible health plan, then you can only sign up for limited FSA, which just means that those funds are limited to dental and vision costs instead of healthcare.
Okay.
Okay.
Shout out to Katie Doctor who dropped the wellness forum link in the chat. So if you're looking for that before you skedaddle, go ahead and click on that link and you can download the form. And it is on the hopebenefits.org website. For those of you who are not familiar with that, that is the website that we have that has all of our health benefits on it. And look for a new and improved healthbenefits.org coming soon in 2026.
That's right. Okay. Thank
Okay.
you.
I think that's all of our questions. Again, this has been recorded. We'll get it. I've got to get out of here and get going to Nashville, so it probably won't happen until tomorrow, but we will get links posted to the recording. So if you want to go back and review anything, look at any of the slides again. It will be coming very soon to a website or inbox near you.
Love that. Okay. Thank you guys very much. Enjoy your day.